October 1st is the target date for what is arguably the most critical element of the president's plan, public health insurance exchanges. Tonight, Chief National Correspondent Jim Angle with some interesting new details about how it's all coming together.
Though the administration has kept it quiet, one reason it expresses optimism the federal exchanges will open on time is that they've outsourced them to several private companies in the health insurance business for years.
They wanted it to be completely government run, but what they learned as they went along is that they weren't competent to do it, and so they're now relying on these private companies to effectively bail them out and help them with some of the technology.
The administration signed contracts with 7 private companies, so whatever doubts about Washington's capabilities, those companies stand ready to crank up the exchanges on October 1st, whether the federal government is ready or not.
To help people just find out whether they qualify for a subsidy or not, yes, we're ready right now. There's no ifs, ands, or buts about it.
We'd like to say we're the first option. But yes, anything that they can't handle, we will be able to handle.
These companies will offer the same range of choices, maybe more, than the federal government, and at exactly the same price.
Think of us as the Amazon.com of health insurance, but there is a much larger number of companies that have tried to do this and have not been successful. E-commerce is not easy, and that's what we're talking about here with these government exchanges.
If these companies offer the same products at the same price and even save the government money, then why build a separate federal exchange at all?
I can't get into why the government decided that they needed to build this platform themselves, because there are several companies, especially ours, that operate a very effective marketplace already.
Makes you wonder why we needed the law in the first place, doesn't it? I mean, it seems like we could have built a reform around many of the activities that were already occurring in the private sector.
Meanwhile, President Obama, appearing with former President Clinton, who's occasionally been critical of the health care law, said today health care had to be a priority, even with a struggling economy.
A mom should not have to go bankrupt if her son or daughter gets sick. That a family who's dealing with a layoff and is already struggling to pay the bills shouldn't also be wondering whether they're one illness away from losing their home.
But saying it and doing it are different things, and it appears private companies are ready to bail out the federal government, saving the federal exchanges even if the administration can't get it together. Brett.
All right, Jim, we'll follow it. Thank you.